Imagine this. You're just sitting, scrolling your phone, maybe watching YouTube like right now, and suddenly there's a strange pressure in your chest. Not sharp, not stabbing, just heavy, like someone quietly placed a brick on your chest. You think, maybe gas? You ignore it. But inside your body, something much more serious has already started. A blood vessel that has been silently getting narrower for years just got completely blocked. And now, a part of your heart is literally suffocating. This is a heart attack. But here's the scary part. Most people don't even realize what's happening until it's too late. So in this video, I'm going to show you what exactly happens inside your body during a heart attack, why it happens, even to seemingly healthy people, the early warning signs your body gives you, and most importantly, how you can prevent it. And don't worry, I'll make this super simple, no complicated medical jargon. Think of this as your heart's survival guide. Okay, first things first, what actually is a heart attack? Let's simplify this. Your heart is basically a pump, a very hard-working pump that never takes a break, not even when you're sleeping, not even when you're binge-watching at 3 a.m. Yes, I'm judging you a little. But here's something most people don't realize. Your heart needs its own blood supply to survive. That blood is delivered through small vessels called coronary arteries. Now imagine these arteries like water pipes. Clean pipe leads to smooth flow. Dirty pipe leads to blocked flow. Over time, due to things like junk food, smoking, lack of exercise, stress, fat, cholesterol, and other substances start sticking to the walls of these arteries. This forms something called plaque. At first, it's small, no problem. But slowly, silently, over years, this plaque builds up and narrows the artery. Until one day, that plaque suddenly breaks, and your body panics. It forms a blood clot at that exact spot, and boom, the artery gets completely blocked. No blood leads to no oxygen, leads to heart muscle starts dying. That is a heart attack. Now let's go deeper. This is where it gets really interesting. The moment the artery is blocked, your heart cells are like, hey, where's the oxygen? Because heart muscle cells are very sensitive. They cannot survive without oxygen for long. Within minutes, they start getting damaged. Within 20 to 30 minutes, some of them begin to die. Yes, actually die. And here's the problem. Dead heart cells do not come back. Your body cannot regenerate them like skin. So the longer the blockage stays, the more damage happens. This is why doctors always say, time is muscle. The faster you restore blood flow, the more heart you save. But if you delay, more muscle dies leads to weaker heart, leads to higher chance of death. Now here's something scary. Sometimes the heart doesn't just weaken, it can start beating irregularly. This is called arrhythmia. And in severe cases, the heart can suddenly stop. That's called cardiac arrest. Yes, this is how heart attacks can become instantly fatal. Now here's the part that can literally save your life. The warning signs. Most people think a heart attack looks like this. Sudden collapse, dramatic chest grabbing, like in movies. But in real life, it's often much more subtle. The most common symptom is chest discomfort, not always pain. Sometimes it feels like pressure, tightness, squeezing, or a heavy weight on your chest, like someone is sitting there rent-free and not leaving. And this discomfort can spread to your left arm, your neck, your jaw, even your back. Now here's where people get confused. They say, maybe it's just gas. And honestly, sometimes it does feel like gas. But here's a simple rule. If it feels unusual, intense, or lasts more than a few minutes, don't ignore it. Now let's talk about other signs your body gives you. Shortness of breath, even when you're not doing anything. Sudden sweating, like your body just ran a marathon, but you didn't. Nausea or vomiting. Dizziness, and a strange feeling of anxiety, like something is very wrong. Your body is literally trying to warn you. But here's the scary part. Not everyone gets chest pain, especially women, diabetics, older adults. They may only feel fatigue, breathlessness, mild discomfort, which makes it very easy to ignore. And that's how heart attacks become deadly. Yes, silent heart attacks are a real thing, and they're exactly as scary as they sound. In some cases, a person has a heart attack and doesn't even realize it. No dramatic pain, no clear warning. Maybe just, I felt a little tired that day. I had some indigestion. and that's it. Meanwhile, inside the body, heart muscle was being damaged. This is more common in people with diabetes because nerve signals don't work properly, so pain doesn't feel like pain. Now imagine this. You ignore it. You continue life as normal, and months later, you find out your heart is already weakened. That's why awareness is everything. Okay, this is the most important part of the video. What should you do if you think you or someone else is having a heart attack? First rule, do not wait. Not 10 minutes, not 30 minutes. Every minute matters. Call emergency medical help immediately. Now, if the person is conscious, make them sit down and stay calm. Do not let them walk around, because the heart is already struggling. If aspirin is available, give 1 tablet to chew. Why? Because it helps prevent further clotting, but only if they're not allergic. Now, if the person suddenly becomes unresponsive, no breathing, no pulse, this is cardiac arrest. You need to start CPR immediately. Yes, even if you're not a professional, because doing something is better than doing nothing. Push hard and fast in the center of the chest. Keep going until help arrives. This can literally double or triple survival chances. So remember, recognize early, act fast, save a life. Now, after everything you've seen, you might be thinking, okay, that's scary, but what can I actually do to prevent this? Good news, most heart attacks are preventable. Yes, preventable. And no, you don't need to become a fitness model overnight. Just a few consistent habits can make a huge difference. First, your food. Your arteries don't like junk food as much as you do. Try to reduce deep-fried food, excessive sugar, processed snacks, and add more fruits, vegetables, whole foods. Second, move your body. You don't need a gym. Even 30 minutes of walking a day can protect your heart. Think of it as maintenance for your life engine. Third, avoid smoking. Smoking doesn't just harm your lungs, it directly damages your blood vessels. Fourth, manage stress. Yes, stress is not just in your head. It affects your heart, your hormones, your entire body. Find ways to relax, even if it's just taking a break from your phone for a while. Yes, I said it. And finally, get regular checkups. Blood pressure, blood sugar, cholesterol. Because sometimes the problem is silent until it's not. Let's be honest for a second. Most people don't think about heart attacks until it happens to someone close, or worse, to themselves. But now you know better. You know what's happening inside the body. You know the warning signs, and you know how to act. And that knowledge, it can save a life, maybe even your own. So the next time your body sends you a signal, don't ignore it. Listen to it, because your heart has been working for you every second, every day, without a break. Maybe it's time we start taking care of it, too. If you found this video helpful, make sure to like the video, subscribe to Animated Health Lab, and share this with someone you care about, because awareness saves lives. I'll see you in the next one.